today we again concentrate on another fat soluble vitamin, which is vitamin D. Vitamin D, though it is we classify it as a vitamin, it is basically a hormone which is 1,25 dihydroxycholecalciferol. This is the form, or this is the active form of vitamin D, which is 1,25 dihydroxycholecalciferol. This is the active form of vitamin D. So how this biosynthesis of vitamin D is taking place? In the skin, we have got Meissner cells, or the Meissner cells, which consist of (7-dehydrocholesterol). 7-dehydrocholesterol is present in the Meissner cells in the skin. On this, when there is UV about 285 to 315 nanometer falling on skin, it leads to the formation of sequesterol. Sequesterol is basically present in the all cis form. Then this sequesterol is transported into cholecalciferol. It is forming the cholecalciferol, which is a form which is actually the provitamin form of vitamin D. Cholecalciferol is a provitamin form. So this provitamin form will be further enter the subsequent pathway for the formation of the active form. So other than that, even we can derive cholecalciferol from fungi. Fungi having a component called the ergosterol, which can ultimately give rise to ergocholecalciferol. So this is also just a form of cholecalciferol. It's a provitamin form of vitamin D. Now this cholecalciferol, which has been formed, now will be acted upon in the liver by 1-hydroxylase, 1-alpha hydroxylase. Sorry, not 1-alpha, it is 25 hydroxylase to form 25 hydroxycholecalciferol. Then this moves towards the kidney. This occurs in the liver, then it moves towards the kidney. Then it is acted upon by 1-alpha hydroxylase to form 1,25 dihydroxycholecalciferol, which is the active form of the vitamin. So we had 1,25 dihydroxycholecalciferol, which is formed in the kidney. Now this 25 hydroxycholecalciferol, if this cholecalciferol is also better known as the vitamin, is also called calcidiol, and this is known as the calcitriol. This calcidiol, if the vitamin D needs to be stored inside the body, in the liver itself will be acted upon by 24 hydroxylase to form 24,25 dihydroxycholecalciferol, which is the storage form of vitamin. This is the storage form. So 24 hydroxylase acts on 25 hydroxycholecalciferol to form 24,25 dihydroxycholecalciferol. So ultimately we get this as calcitriol, which is 125 dihydroxypolycalciferol, also known as vitamin D3. This calcidiol is also sometimes known as vitamin D2. Vitamin D3 is much stabler and more efficient obviously than vitamin D2. Vitamin D3 synthesis basically involves skin, liver and kidney, because the hydroxylase enzymes are present in various locations. So this is what we have for the metabolism part of vitamin, and as it involves this UV 285 to 315, the vitamin D is better also known as the sunshine vitamin. It is also better known as the sunshine vitamin. Now moving on to the functions of vitamin D. Vitamin D, as we have already discussed, it is basically acting like a hormone. So it has got certain roles in basically three structures. One, it has some roles in the intestine, it has got some roles in the renal tubules, and it has some roles in the bones and teeth. So vitamin D will actually stimulate the bones. It will actually stimulate the bones, or rather it will stimulate the odontoblasts, and therefore it will stimulate the deposition of more, or the calcification of bones to take place. Secondly, in the renal tubules, it will prevent the excretion of calcium. At the same time, it will also prevent the excretion of phosphate. So it basically is rather preserving, or it helps to maintain the calcium level. So it prevents the excretion of calcium and phosphate. And it is also acting upon the intestine, where it will stimulate the synthesis of a protein called calbindin. Stimulate the synthesis of a protein called calbindin, which will stimulate the absorption of the calcium. So vitamin D is very important for the absorption of calcium from the intestine, which we eat as food. The sources of vitamin D are sunshine. Apart from that, vitamin D is also present in milk and various other green leafy vegetables. So these are the basic three important functions of vitamin D, and it has got also certain roles in the teeth, because here also it helps in the deposition, and also in the deposition of teeth it also helps to maintain the structural integrity of the alveolar jaw and stimulate the alveolar bone regeneration. And in the bones, it is also stimulating the synthesis of osteocalcin. So these are some of the very important functions in the bones, renal tubules, intestine and teeth. So vitamin D is one of the most important things which is required for maintaining the calcium homeostasis inside the serum. Apart from that, there is another important function which is present in the bone. Besides the role in osteogenesis, it also helps, or it also has an osteoclastic activity, or it also helps in the breakdown of bone, or in the decomposition of bone, in order to maintain the serum concentration of the calcium inside the body. So this is what we have for the functions of vitamin D. Now, what are the conditions which leads to, or what are the diseases associated with vitamin D deficiency? Vitamin D deficiency will lead to disease called Rickets. Rickets is a disease which is associated with vitamin D deficiency, and the child basically has a pigeon's chest. he or she has Ricky rosary, or it's a kind of a erythema of the skin. The patient may suffer from alopecia or loss of hair, or he can have a bow-shaped legs, having a frontal bossing, and these are the very common features of rickets. After that, the rickets can basically be of two types. One can be renal rickets, where there will be elimination of high amount of calcium, and so this renal rickets will be associated with secondary hyperparathyroidism, because parathyroid is a hormone which is associated with the elevation to increase the serum concentration of the calcium. When there is deficiency of calcium in the blood, this parathyroid level inside the body will increase, and therefore it is a secondary symptom or secondary cause which will lead to the increase in the parathyroid hormone when a patient is suffering from rickets or renal rickets. And another type of rickets, one is the renal rickets, another type of ricket is there, which is the VDR ricket, or because of the vitamin D receptors are not VDR associated rickets, where the VDR or the vitamin D receptors are inactive, or they cannot reset the vitamin D as such, leading to a condition which is a vitamin D receptor associated rickets. So these are the two types of rickets. This basically occurs in children, and in the case of adults, it leads to a condition called osteomalacia. Osteomalacia is a condition where the bones become fragile, and it has a tendency to break very easily. In the case of women who are basically in their postmenopausal phase, they have a chance of having minute fractures all over their body just by sneezing or normal activity. This occurs basically due to extreme osteoporosis, which basically occurs due to deficiency or insufficiency of estrogen. Estrogen basically has a role in the vitamin D, maintaining the level of vitamin D, and therefore when estrogen level decreases, there is a decrease in the associated level of vitamin D, leading to the decrease in the serum concentration of, or in the blood concentration of calcium. Now, to replenish the serum calcium level, because calcium is a very important component for muscles, cardiac muscles, and also the skeletal muscle action. Body cannot just work without calcium. So to maintain the serum calcium level, the osteoclast will be stimulated, and the osteoclast will act upon the bone cells, and thus the bone cells will be resorbed. And this resorption of the bone cell with the help of osteoclast will lead to the elevation of the serum calcium level. This elevation of the serum calcium level is actually what will lead to the fragility, or the bone becoming weak. This weak bone will lead to certain fractures called the loser zone, which can be easily be seen in the radiographic imaging of a bone in the case of postmenopausal women. So vitamin D is basically very important for a postmenopausal woman, and this vitamin D deficiency is also very common in old age in Indian civilization. Now, what is the normal concentration, or what are the normal level of calcium in our body? The normal level of calcium in our body is 9 to 11 gram per dl. So this is the normal concentration of calcium in our body, and to maintain this, the normal vitamin which should be taken in is about, for a man, is about 400 IU per day. For a woman, it is about 600 IU per day. and for old age it is about 800 IU per day. So this is what we have. And similarly, vitamin D, as it is a fat soluble vitamin, with hypervitaminosis is not at all accepted because it is going to have several problems associated with the normal other fat soluble vitamins like nausea, vomiting. Vitamin D deficiency can occur due to a person not going out in sunshine for a long period of time or having less contact with sunlight can suffer from vitamin D deficiency. The other cause of vitamin D can be there is some other gallbladder related diseases or some other hepatic disease such as steatorrhea, obstructive jaundice, which may also stimulate the vitamin D decrease the vitamin D level. It may also be due to suppose the vitamin D receptors are not working properly. So these are the basic three problems which may lead to the deficiency in vitamin D in our body. And one last thing is that in general, people living in northern hemisphere, means India and other countries, have a general tendency of vitamin D deficiency in the month of November and December. This is due to the light, which is basically or the UV light which is required for vitamin D synthesis, which is in the range of 285 to 315, is not available at that time because we are having winter at that time, and where the sunlight or the sun's rays which are reaching the northern hemisphere are of much longer wavelength, and therefore they are not sufficient for stimulating the vitamin D biosynthesis. So this is what we have for vitamin D. I hope you enjoy the session. Thank you.